Scenario 1, Digestive System Gastroenterology. A 58-year-old female was rushed to the emergency department following 3 bouts of hematemesis and a single bout of melena. On exhibition, she was tachycardic and hypotensive at 121 beats per minute and 90 over 50 mmHg, respectively. She manifests pallor with no interrus. She is euphonic and normothemic, but reports intermittent permit-voluptual tenderness. Medication history reveals occupational intake of non-custodial anti-inflammatory drug naproxen 250 milligram for arthritis management. On admission, her complete blood count revealed a hemoglobin level of 5.1 G/dl, hematocrit of 32%, prolonged prothrombin time, and a positive guaiac test. All laboratory results studies were within normal limits. Based on these clinical presentations, intravenous fluids were administered and 3 bags of packed red blood cells were transfused. A gastroenterologist was consulted and an upper gastrointestinal endoscopy was performed, which revealed a 1 by 1 centimeter hemorrhagic gastric ulcer. The bleeding ulcer was categorized and biopsies were taken for Helicobacter pylori, the results of which were all negative. Proton pump inhibitors were started and she was discharged after 2 days in stable condition. Scenario 2, Diabetes Subsequent Diagnosis. A 58-year-old female with non-insulin dependent diabetes mellitus was seen in her primary care provider's office with reports of diminished sensation in both feet and occasional blurred vision. The client admits to problems adhering to her prescribed dietary and medication regimen. She doesn't exercise regularly, takes her medications only when she is reminded, and doesn't watch her diet. She denies dyspnea, polyphagia, polydipsia, polyuria, and diaphoresis. The client had history of non-insulin dependent diabetes mellitus for 15 years and dyslipidemia and hypertension for 8 years. She had laser photocalculation for retinopathy in the past year. She is on metformin and glipizide for control of her hyperglycemia, hyperhydrochlorothiazide, and ramipril as antihypertensives, and atorvastatin for hyperlipidemia. Upon examination, her blood pressure is 85 over 98 mmHg. Fasting blood glucose is 265 milligram slash DL. Hemoglobin A1C is 9%. Serum, blood, urea, nitrogen, and creatine at 53 milligram slash DL and 4.4 milligram slash DL, respectively. Urinalysis and 24-hour urine collection uncovered trace protein and urinary albumin excretion rate of 255 milligrams per day. leading to a diagnosis of microalbuminuria. Nerve condition studies and electromyography confirmed diabetic neuropathy, decreased visual acuity, and new extensive reticular vascular growth were revealed through an ophthalmologic exam. Based on the client's typical presentations, the final medical impression and diagnosis is uncontrolled insulin dependent diabetes, mellitus, complicated by hypertension, dyslipidemia, neuropathy, retinopathy, and mitral buminuria. Thank you.